Dr. Pat with Little Critters, and we have a king snake with us today. King snakes are named king snake because they do tend to eat other snakes and are immune to the venom of other snakes. They'll also eat lizards and rodents very commonly as well. They're very common all over North and Central America, and they are known in our area to actually eat rattlesnakes. So they are the king of snakes just because they will prey on the others. This beautiful snake is a 24-year-old king snake, which means we're a senior king snake at this stage. And as you can see, if we look at the eyes, it looks like the eye is bulging right here. And on this side, you can see a little bit of tissue hanging off the eye. And these are retained caps. And with the last shed, we didn't lose these caps. So snakes don't have eyelids. So snakes can't blink or squint because they don't have an eyelid. And the way they protect the surface of their eye is with a scale that's clear so that they can see through it. But when they shed, they have to be able to lose that scale. And if they have problems with shedding, then we'll see these retained and we get fluid buildup under it. And they do have some difficulty seeing. They can see, but it's going to be cloudy and blurry. This little one was actually having trouble finding his prey, which is frozen thawed. We never feed live, but he was striking off to the side and not accurately. The treatment for this, at home, you want to increase the humidity because it's often associated with lack of humidity in the environment. If you're seeing what looks like retained caps, you can put them in a warm, humid chamber or soak them in a water dish for 20 to 30 minutes. And you can gently use a little Q-tip, and you should never use any force or any pressure, but you can just gently swab and see if the cap comes off. If it doesn't, it should be taken to your veterinarian because you can damage the eye if you try to pick these off. You have to be very careful. But again, if you're having retained shed problems in general, and certainly caps, you need to look at the humidity in the environment. And this little one is actually starting to go through a second shed, and you can see we're just starting to lift some of the scales. And if you notice the difference, king snakes are generally very shiny. They're actually a beautiful snake. They come in many different colors and patterns. And if you notice the difference here, we have the new skin under here, which looks very shiny, and then the older scales that are a little dull. And that's very typical when they're shedding. Our plan today with this little one is to lubricate the eyes. We are going to soak him and soak these eyes, and then we're going to gently remove these caps. The other issue is he's 24 years old, not really an issue, but he's a senior snake. And so we do recommend getting some blood work from him and running a metabolic profile, just like you would on your cat or your dog or yourself. It tells us a lot about what the organs are doing and if there's any problem there. And it's always a good idea to be preventative with your exotic pet care, not reactionary. Way too often, owners see them as almost self-sufficient. They don't show a lot of clinical signs of disease, so it's not picked up on. And so when we see them, it's a big problem, and we could have intervened with a little problem, which is more cost effective and better for the snake and better for the owner that loves them.